India's recent overhaul of tobacco taxation marks one of the most significant fiscal and public health shifts since the introduction of the Goods and Services Tax, GST. The new regime, notified by the Union Finance Ministry and effective from 1st February, follows the passage of the Central Excise Amendment Act 2025. It seeks to simultaneously discourage tobacco consumption and secure a stable, purpose-specific revenue stream for health and national security priorities. Rationale for heavy tobacco taxation. Tobacco and related sing goods, such as pan masala and alcohol, are taxed heavily in India due to their serious public health and social costs. Global bodies like the WHO recommend that tobacco prices rise faster than income growth so that real affordability declines, thereby curbing consumption over time. In India, however, stagnation in effective excise duties in recent years meant that cigarette prices did not increase sufficiently in real terms, weakening tobacco control efforts. Existing tax structure and its limitations. Tobacco taxation in India has traditionally operated through a multi-layered structure comprising GST, Central Excise Duty and a Cess. Tobacco products have consistently been placed in the highest GST slab as they are classified as demerit goods, yet cigarettes and other products remained relatively affordable despite high nominal tax rates. This combination of complex taxation and limited real price increases created space for high consumption and loopholes, particularly in smokeless tobacco. End of GST compensation cess. The GST compensation cess, introduced in 2017 to offset states' revenue losses from GST, continued far beyond its original horizon due to pandemic-induced fiscal stress. From 1st February, the compensation cess on tobacco products will cease, as the original compensatory purpose has largely been met. Tobacco was among the last items to carry this cess, underscoring both its revenue significance and its role in larger public policy. New excise and cess framework. To replace the outgoing compensation cess, the government has notified revised central excise duties on tobacco products along with a new cess under the Health Security cum National Security Act, 2025. This new levy applies to pan masala and related units and is designed as a dedicated, non-lapsable cess that will not merge with the general pool. The intent is to fund long-term security preparedness and capacity building, including health security, without increasing the overall tax burden on the wider population. Revised GST slabs and valuation. The reform also simplifies and differentiates GST rates across tobacco categories. These have been shifted from the 28% GST slab to an 18% slab, while all other tobacco products, including cigarettes and chewing tobacco, now fall under a 40% GST slab. This change aims to align tax incidence more closely with relative health risks and to streamline the structure. For smokeless tobacco products such as gutkha, khaini, jarda and chewing tobacco, GST valuation will now be based on the declared retail sale price, RSP, on packaging, tackling evasion and strengthening enforcement. Basing valuation on RSP is expected to curb under-invoicing and underreporting that have historically plagued the smokeless tobacco segment. Clearer valuation rules and higher effective taxation on high-risk products strengthen enforcement and reduce scope for manipulation across the supply chain. This is critical in a sector where informal production, small units and diverse product forms make compliance difficult to monitor. Public health and fiscal significance. By raising effective taxation and tightening valuation, the new regime pushes tobacco prices upward relative to incomes, bringing India closer to global best practice recommendations on tobacco control. Higher prices are expected to reduce affordability, discourage initiation among youth, and promote quitting among current users over time. At the same time, the dedicated, non-lapsable cess architecture provides predictable, long-term funding for health security and national security without resorting to broad-based tax hikes. Conclusion: aligning tax policy with health goals. The restructuring of tobacco taxation thus serves a dual policy purpose. It reinforces India's public health strategy against tobacco while preserving and repurposing a critical revenue source. By ending the temporary GST compensation cess, introducing a targeted health security cum national security cess, revising GST slabs, and adopting RSP-based valuation for smokeless products, India is attempting to align fiscal design with health and security priorities in a more coherent manner.